Good morning, everyone. My name is Kamille Deloach, and I am a biochemistry and molecular biology major at Fisk University. Today, I will be presenting my research titled Promoting Breast Cancer Knowledge and Early Detection in Middle Tennessee College Communities. This project focuses on increasing awareness, improving knowledge, and encouraging early detection practices among college students. Here is my table of contents of the topics that will be discussed during my presentation. Okay, so breast cancer is the most commonly diagnosed cancer among women in the United States and a leading cause of cancer-related death. Although incidence rates are similar across racial groups, African American women experience higher mortality rates due to factors such as aggressive tumor subtypes, healthcare access disparities, and systemic inequalities. Because college-age populations are at a crucial stage for forming lifelong health behaviors, I want to explore whether education at this level could make a measurable impact. So, with that being said, my research question was, does culturally tailored educational intervention improve breast cancer knowledge among college students? And my hypothesis was that participants would demonstrate increased breast cancer knowledge and awareness following the intervention as measured by post-test and compared to pre-test. So, my methods. To evaluate this, I use pre-test and post-test study design. Participants completed a knowledge assessment before and after the intervention. I hosted an in-person educational workshop in collaboration with campus and community partners. To recruit participants and increase engagement knowledge, I created informational flyers and shared weekly educational content through my Instagram and TikTok. Surveys were administered anonymously using Google Forms. I chose this mixed outreach approach to meet students where they are, both in person and online, because digital engagement is especially effective with college populations. The intervention combined culturally relevant health education with digital outreach. It addressed both biological risk factors and social determinants of health contributing to disparities. The workshop included discussion-based learning, community collaboration, and peer engagement. What made this innovative was the integration of traditional health education with social media strategy, creating a scalable model that could be replicated within our HBCU community. This approach allowed the message to extend beyond the classroom and into students' daily digital environments. So, with my results, a total of 57 participants completed both the pre and post test. Results showed improved identification of breast cancer risk factors and non-risk factors. Participants also demonstrated increased awareness of emotional challenges faced by survivors and stronger recognition of community awareness as a tool for early detection. What stood out to me the most was how many students expressed how they previously underestimated their role in promoting early detection. After the intervention, they felt so empowered to share information within their communities. In conclusion, the intervention effectively increased breast cancer knowledge among participants. However, there were limitations. The sample size was relatively small compared to how I wanted it to be. The assessment measured short-term knowledge rather than gain of long-term behavioral change, and the study was conducted on a single campus. Moving forward, I plan to expand this intervention to additional college and HBCUs, incorporate longitudinal follow-up assessments, and strengthen partnerships with clinical providers and peer health organizations. This will allow for the broader impact and sustained behavior outcomes. I would like to thank Christina Haygood, Jaha Martin, and the Fisk Rotaract Club and the HBCU Wellness Project for their collaboration and support. The references used in this research are listed on the slide and the poster. Thank you so much for your time and attention.